Thank you, Chairman Graham and Ranking Member Whitehouse, for holding this vital hearing about the science behind medical marijuana. I've met with many families in my state who desperately need access to this medicine. Many of them have severely ill children, and some of these children have literally 100 seizures a day. These families have met with doctors who have told them that medical marijuana could drastically reduce the number of seizures that their children suffer from. But if they take that advice, these families would have to break a federal law to get access. That doesn't make any sense. I know some people are saying that we should wait until there's more research before changing the laws. But the one thing that's blocking the research is the law. Federal law defines cannabis as a Schedule I drug, which by definition means no medical use. Schedule I designation also triggers the most restrictive limitations on research. It means that for someone to perform medical research on marijuana, they first have to obtain that Schedule I license. This is more difficult to get than a Schedule II license. Schedule I means that researchers have to identify a Schedule I manufacturer to supply the study. In the case of marijuana, there is only one supplier allowed by the DEA in the whole country, the University of Mississippi, through the National Institute of Drug Abuse. Schedule I means researchers have a much higher bar to meet for preventing diversion when the DEA inspects their facilities, including installing bolted safes, which are not practical for most clinical settings. Schedule I also means if a researcher makes any change to his study or protocol at any point, they have to stop the study until the DEA approves the change without any timeline for those approvals, creating costly delays and impeding research. Finally, Schedule I means that a researcher must personally administer the drug to each patient, which is extremely difficult to do if a study has large numbers of patients. On top of this, federal sources such as the NIH and the VA are much less likely to fund research on therapeutic uses for Schedule I substances because, by definition, they have no accepted medical use. Because of these unnecessary barriers, last year only 2 researchers in the entire country were able to legally obtain cannabis for research in humans. How can we get the information we need about this medicine if our laws are blocking scientists from doing the basic research? The federal government needs to catch up with the medical community and the public. State lawmakers and voters in 42 states, including New York, my home state, have already recognized that medical research is showing that medical marijuana can alleviate symptoms and even treat a variety of illnesses, from MS to cancer to severe forms of epilepsy. Unfortunately, the federal laws don't allow any medical use of marijuana, even in the states where it's legal. Under current law, patients and doctors have no treatment options or must use dangerous alternatives that often have severe side effects, such as opioids. Many patients are substituting medical marijuana for addictive prescription opioids, and they are avoiding those severe side effects while saving taxpayers dollars. A recently published study shows that states that have implemented medical marijuana laws have saved over $160 million in Medicare Part D costs. I've introduced a bill with Senator Booker and Senator Paul that would lift these barriers to research and allow doctors, not the government, to decide if medical marijuana is the best option for their patients. The bill is called the CARES Act, and it would finally allow patients and families in states where medical marijuana is legal to access the medical care without fear of prosecution. Families shouldn't have to violate the federal law, risk arrest, just to give the medicine they need. And just to describe a couple of these families. So when I've met the children, their mothers say to me, my child has 100 seizures a day. Any one of those seizures could kill her. If I get access to CBD oil, those seizures stop and she gets 1 or 2 a month. So you can imagine how important that medicine is to them. One little girl named Charlotte Figge is the reason why it's called Charlotte's Web, which is one of these CBD oils that had a miracle effect on her. So you cannot say these drugs don't have effects. They have medical effects. And for this one particular class of patient, it's life-saving effects. Thank you.